Thank you very much, Hajot, for that introduction. And thank you, everyone, for joining us on this session today as we begin to build our support for reclaiming the table, for ensuring that self-care is included on the agenda of the 2026 high-level meeting. So I'm just going to start off by giving us a brief overview on what self-care is so that we're on the same page, why we're pushing for self-care to be an essential part of commitments and decisions on health going forward, and also just briefly what the Self-Care Trailblazers Group has done or continues to do to make sure that the agenda of self-care remains in the forefront. Next slide, please. So I just wanted to start off with the definition of self-care, and I'm sure many of you are very familiar with this differently. So for some, it will be healthy nutrition, healthy lifestyles, exercising, taking care of your skin, etc., brushing your teeth, the many things that we do to care for ourselves. But since 2018, we've come up with a much broader definition from WHO that aims to bring out self-care as an essential part of the health system. So the definition is that self-care is the ability of individuals, families, communities to promote health, prevent disease, maintain health, and cope with illness and disability. And an important aspect is that they can do this with or without the support of a healthcare provider. And then at the bottom there, there's just some broadening of the scope of what this definition means. And this definition includes things like health promotion, so creating awareness about health, disease prevention and control, self-medication, providing care to dependent persons, seeking specialist care or hospital care if necessary, and even rehabilitation, including palliative care. I think the most important thing to recognize in the definition of self-care is the role that the individual takes. The individual is responsible for acting or not acting to preserve their own health. And it is this aspect of the individual's involvement in their care that we're working towards strengthening and ensuring that it becomes an essential part of our health systems. Yeah, next slide, please. On this slide, I just wanted to share just a few bullets on why self-care. Why is it important that we push self-care into the health agenda? First and foremost, we know that half of the world's population currently lacks access to essential health services, especially in the low and middle income countries. Whether it's poor people, marginalized groups, such as adolescents and young people, or young women and girls who are stigmatized and therefore do not want to seek care in our traditional health systems, people living with HIV, or even people in humanitarian circumstances or war conflict situations for who the traditional health facilities are probably not accessible. So self-care can be an important strategy for increasing access, especially to these groups that I have mentioned. Secondly, we acknowledge that there's a growing shortage of health workers. There is a shortage and it continues to grow. And it is estimated that by 2030, there'll be a shortage of 18 million health workers. With such a shortage, it goes to without saying that many people are unable to seek services from healthcare providers because they're just not able to reach the populations. And self-care can play an important role in addressing this gap by removing some of the individuals from the health facilities because they are able to effectively self-care for themselves. Self-care can help to address the shortage of the health workforce, but also help to thereby strengthen the health systems, which are already fragile and overstretched. So that's an important point. And by addressing these key areas that I have mentioned, self-care can contribute towards achieving universal health coverage and thereby help countries to achieve the SCTG, SDG 3, making health systems stronger, making them more equitable, and making them more efficient by diversifying beyond just our traditional health facilities. And we've had experiences with various pandemics globally, COVID-19 being the most one that is in our recent times. And these pandemics, and now we're facing Ebola. Of course, they continue to be threats because of the status of our health systems. And self-care is an innovative approach that can help reduce that pressure and help improve healthcare overall and help us move towards universal health coverage. And finally, I just want to mention that there are many governments that are buying into self-care. It was estimated, I think at the end of last year, that more than 40 countries have developed national self-care guidelines, and they're at various stages of implementing them, making self-care part of their health systems, including self-care in the national health management information systems, etc. The Self-Care Trailblazers Group, for example, works in 5 focus countries, and these countries are already implementing different strategies for self-care as part of their national self-care guidelines. So self-care is the tool that we need. It is the innovative approach that we need. And we want to make sure that we are talking at the high-level meeting to ensure that self-care is incorporated in any language or commitments that come out of that meeting. Yeah, next slide, please. So I just wanted to and I'll quickly run through this slide because Hajot already mentioned the Self-Care Trailblazers Group is a global coalition. We have over 1,000 members, about 50% of them fairly active. We have more than 500 institutions. So we are really like a movement. We're able to help advance the mission, and our mission is to expand the safe and effective practice of self-care so that individuals can better manage their own health outcomes are improved, and the health systems are better equipped. And it's important to just relook at that mission in detail. Sometimes we're not saying that governments should negate their role to provide healthcare. And so in promoting or advocating for self-care, we want to make sure that the individuals are actually empowered to self-care, that their costs are addressed within the financing of healthcare, among others. So that's just more about the Self-Care Trailblazers Group. You can also read more from our website. Yeah. Next slide, please. And I just wanted to finalize with sharing with you some of the things we've been able to achieve as we work towards advancing self-care. As I've mentioned, we work in 5 focus countries. They're listed there. And these countries all have national self-care guidelines that have been developed by national self-care networks that are led by the ministries of health. They've developed guidelines. They are implementing various interventions and tracking these to really show that self-care have an impact on health services overall. The Self-Care Trailblazers Group is also involved in advocacy at the global level, and this meeting is part of our work towards advocacy at the high-level meeting on HIV. We want to make sure that global commitments and policies include self-care as a strategy for achieving universal health coverage. We publish a biannual state of self-care report that really brings together learnings on self-care, and the latest report was published in 2025. So you might want to go in there to find more information on where countries are with implementing self-care. And this year we'll be holding one of our biannual self-care learning and discovery series. It's a mini conference. The only conference, I believe, that is specifically on self-care. And again, we're inviting our members to send papers for consideration, abstracts for consideration for presentation at this conference, which will take place in October, November. And then finally, we engage with all our members annually because we want to hear from you. We're a coalition, and the decisions we make, the strategies we propose, are vested on your input as well. So you're also welcome to take part in the annual member summit and share your experiences and your lessons and best practices. And on the last slide, I just have a list of people from the Self-Care Trailblazers group, should you be interested in getting any support. Yeah, you have the contacts there and you can reach out to the Secretariat for information. Thank you very much. Back to you, Harriet.